They're usually because of four things, and I wanted to talk about the 4 reasons we get running related injuries in the clinic. So the 4 things are: there is strength related running related injury, there is stability related injury, there are training load related injury, or there are technique related injury. So I thought I'd start from the top and just give you guys a little bit of an understanding about the different types. So with a strength related running injury, it can be from a number of things. I'm not talking about go become a powerlifter and lift ridiculous weight. It's about strength in the right areas for running. If you guys want any sort of details as to the types of strength related exercises that are really good with running, I could talk about all the different types, but the big one I wanted to talk about to you guys today is your calf related strength. So talking about the calf, everyone always thinks when we're talking about the calf that we're talking about the gastrocnemius. And the gastrocnemius is our big fat calf muscle that sits over the top, and we usually use it with powerful movements. So think sprinting, Olympic lifting, jumping, HIIT training, that sort of thing. We're not necessarily using it to a great extent when we go running, although we do use it a little bit. We are using another muscle called our soleus, and our soleus actually sits underneath the actual calf, and it's the main contributor to that push off when you run. So when you're putting your foot down and you go to push off, we're usually using our soleus. The soleus it's an endurance-based muscle, and that's why we use it for jogging. And it's really, really important to have good soleus strength, because if you don't have that, you start to wear and tear on the muscle. And that's why if you're one of those people and you're finishing the run and you're getting this amazing tight calf all the time and you're wondering, why is my calf always tight? You're stretching it all the time, and you find that when you're stretching it, you actually aren't getting anywhere, still remaining tight, still remaining sore. What you need to really focus on is actually strengthening the soleus muscle. Because when we're running, we're putting between 3 to 8 times, depending on how fast you run, the load on our joints as we would be when we're standing and walking. So there's a hell of a lot more load going through the joints. So actually getting that strength through that muscle is really, really important. If you do, the simplest way to test if you're really, really weak through the calf, you can do 2 tests. So you can do a single leg calf raise where you get onto a single leg and you see how many times you can do a calf raise on a single leg. You can do that sort of with a straight leg. That'll test more your gastroc. Or if you want to test your soleus, which is the more important one, do exactly the same thing, but with a bent leg. So do the same thing, but with a bent leg, and see how many times you can actually do it. And what you'll probably find is on that anoid side, the tight calf side, you're probably going to find that you can do far less on that side. And that needs to be what you need to work on. So doing calf raises on a bent leg, and there's a hell of a lot of different soleus exercises out there, and I'll probably do another post in the next couple of days, and I'll chat to you guys about some good exercises for the soleus as well. So that's the biggest strength takeaway that I could give you guys tonight. Strengthen your soleus muscle if you're getting tight calves or calf related pain when you're running. The second one is stability, so being stable. And we're all going through a period where we're not really as stable mentally at the moment. So getting out and doing running is actually really, really good for keeping us nice and stable and sane. But on the other spectrum, we need to keep our hip, our knee, our ankle nice and stable when we run. So if you're somebody who gets hip pain, knee pain, or even ankle and foot pain when you're running, the chances are that you have a stability problem. If you're somebody who's had recurrent ankle sprains, if you've been told you have a hip tendon problem at the moment, again, you're probably somebody who has a stability problem when you run. So it's really important that we stabilize the muscles. The biggest thing and the biggest thing I find with running related injuries, it's not necessarily the knee. Even if you have knee pain, the knee is just the place that cops it. So if you're going running, you're like, oh, I've got all this knee pain. The chances are it's above or below. We're just like a big chain. So essentially we do have problems going up and below. A great way to differentiate if it's ankle or the hip that's causing it, past history. So if you're getting a lot of glute related pain, then chances are it could be a hip related issue. It doesn't have to be though. And if you're somebody who's had repetitive ankle sprains, after an ankle sprain, we become progressively less stable through that ankle, and we really do rely on the muscles around the ankle to actually help with increasing stability. So really, really important to stabilize. If you want to check out 2 tests that actually can help differentiate, try going onto a single leg on both sides and try closing your eyes, keep your legs straight and see how long you can last on both sides. You'll probably find on the side where you're getting a little bit of foot pain or ankle pain that you're a little bit more unstable. So that's just suggesting that we need to focus on that. And same thing if you get onto a single leg. So we're on a single leg, you're doing your single leg squat. So you go down for a single leg squat, and you'll probably find on the glute side, if it's a glute related issue, that you'll see that knee start to track inwards. And that just means that you've got a glute that's not firing, and that glute muscle there is actually causing the issue. And so they're the things we need to strengthen. It's really important that you follow a progressive fashion where you go from working those muscles in isolation and then moving towards more functional exercises that kind of help with running. So don't just go straight to the single leg crazy exercises, because you'll probably find that you'll be able to do them, but you'll just be doing them wrong and you'll cause more pain in the process. The third one is training load. So making sure that we work on our training load. Training load's a huge thing, not just for running, but for a lot of injuries. And if you have gone from not doing too much running to running a lot, and you're getting these niggles and pains, it's probably because of training load. And there's three big things that we see, or 2 major ones really, that we see with training load. We can see bony injuries. So the perfect example of a bony injury is shin splints, which are basically just like stress fractures on the inside of your tibia bone, or tendon related injuries. So if you're someone that's getting a really sore Achilles after training, or a really sore side of your hip, chances are it's because of a tendon related injury. And so when we look at that, we have to think about, okay, what is my training load? When we train, we're essentially stressing out the body. So that when we're doing our training, the body stresses out. We kind of stress the body. The biggest thing is we should allow the body to rest. So when we rest, we actually come up, and if that's our level of fitness, ideally we want to be going beyond that after we recover, if we train right, which allows the body to go through this process called supercompensation. And from there, we get better and better, and we train. The problem with overtraining is if you're just doing your training and you're not giving adequate rest, that's when we start to fail a little bit more, and that's when we start to see those overtraining injuries come in. So really making sure we work on working on our training load and not going above and beyond. If you haven't ran in a while, you don't need to go run the 10K coastal run, because you're gonna injure yourself. So just starting really slow. If you're in Bondi, maybe do a couple of Bronte returns or up to Dover Heights. Just take it easy and slowly phase yourself back to running. And the last one is your running technique. So with running technique, it's really, really important that you have a nice, efficient running style. And probably the biggest one I think I see in the clinic is people that are overstriding. And if you want to test, if you want to have a look at if you may be overstriding, a really cool way to do that is if you're tracking your runs when you go for a run, have a look at your running cadence. And most people's running cadence fall between 150 to 165. And what we really want to do with our running is we want to try and increase our cadence. It doesn't have to be, they say an optimal amount is around that 180 to 185, but every person is different with their running style. But we ideally want to be contacting contacting the ground when we're right underneath our body. And what that does is it allows us the ground reaction force when we're hitting the ground to push straight up. If we're overstriding, we're hitting the ground ahead of us. The ground reaction force is pushing back into our body, which is creating an inefficient running style, and also putting a lot more pressure through the knee and the hip and the ankle. So that's when we start to see a few of those running related injuries as well. Not COVID. Usually we have a treadmill and we do running assessments, but we're not doing them at the moment because we don't have a treadmill. There's no indoors that we can actually utilize. So once this whole period is over, we'll be doing running assessments again. And if you are interested in getting a running assessment, we can do a running assessment and have a look at how you're running and have a look at a lot more things than just your running style to see if there's any issues with that may be creating your pain as well.